Sunburns. Sunburn is a type of burn caused by ultraviolet radiation, usually sourcing from the sun. The most common area subject to sunburns is skin. They form when skin is exposed to sunlight for an excessive period of time. Redness and skin being hot to the touch are the first alarming signs to seek shadow or protect. Cover the affected areas. However, at that point it is already too late to do anything to prevent the consequences. One can only slightly reduce the burning sensation, usually occurring from 2 to 6 hours and reaching its extreme from 8 to 48 hours after the exposure, although nothing can be done against skin peeling off, since this is a part of its natural regeneration. Your classmates are now about to demonstrate how a sunburn forms and how to treat it properly. So please, pay attention.
There is many different ways of treating sunburns. Here are some of them. Hold the burn under a stream of cold water. Put a wet towel or cloth over the burnt area. Drink plenty of water to avoid dehydration. You can also spill some yogurt over it to keep it cool for a longer period of time. Pouring some freshly squeezed lemon juice on the burn will reduce the pain. Moisturizers can also help hydrating the skin. Despite all these methods, which are almost certain to do their job well, prevention is always better than cure, so use sunscreen. At the end, if all of this doesn't work for you, you can still put the burn in a cold place, a freezer for example. But careful, holding it there for too long can cause another serious condition, a frostbite. Luckily, we are here to provide you some possible ways on how to treat them. Treat them as following. Warm the affected area and wrap it in warm blankets. Remove wet items of clothing. Avoid rubbing the area.
We showed you one example of how one can become frostbitten. Though outer conditions such as low temperatures, extreme winds, are far more likely to be the cause. Frostbite is a medical term used to describe damage caused to skin and inner tissues due to freezing. It is most probably to occur on parts of the body furthest from the heart, because warm blood is pulled from limbs and skin to preserve the functions of vital organs. There are 3 types of frostbites, ranging from light to severe injuries. The mildest is called frostnip and can be recognized by red, yellow patches and numbness. It is generally not a permanent damage, since only upper layers of skin are affected. Moderate injury due to tissue cooling is confirmed when skin freezes and hardens. However, deeper parts remain intact and functioning well. Its usual consequences are temporary blisters and sometimes permanent insensitivity to both hot and cold. And the last most severe injury is called deep frostbite. It affects muscles, inner tissues as well as nerves and is indicated by a waxy hard skin, numbness and incapability of moving or feeling anything. The damage is never completely repaired and occasionally an amputation is required. Narrated by Google Phonetic Arts Instrument. All rights belong to Google.